Kidney are the pair of excretory organ present in the posterior abdominal wall behind the peritoneum. It extends from T12 to L3 vertebra. Right side of kidney is slightly lower due to the presence of liver. It occupies epigastrium, right and left lumbar, and the umbilical region of the abdominal. The kidney has upper pole, lower pole, medial border, lateral border, two surface, anterior surface and the posterior surface. Now let's talk detail about it. The upper pole is near to the vertebral column and is in contact with the suprarenal gland, whereas the lower pole is pointed and the long axis of kidney is in direction of the downwards and laterally. So lower pole is away from the vertebral column and the upper pole is towards the near the vertebral pole. So the long axis of the kidney is downwards and laterally. The anterior surface is rough and irregular because of the presence of the impression of the visceral organs, whereas the posterior surface, it is flat because there is presence of the long muscles. So impression of the muscle produced is flat. Surface marking of the kidney can be done through the back. It is done within the parallelogram of the Morris, which is drawn in the following way. The first two horizontal line is drawn at the level of the spine of the T11 vertebra. So we have traced this T7. This is the inferior angle of scapula. From here, this is the T7, then T8, T9, T10, and the T11. From the T11 spinous process, we have drawn a horizontal line, and then T12, L1, L2, L3. So another horizontal line we draw at the spinous process of the L3 vertebra. And the two vertical line is drawn, that is one 2.5 centimeter away from the posterior median plane. So this is the 2.5 centimeter away from posterior median plane, right and left side, and then 9 centimeter away from the posterior median plane. So this is two vertical line. So this is the position of the kidney through the back. So we approach the kidney through posterior surface. Now talking about the renal angle, this is the angle that is formed between the lower border of the 2L3 and the lateral border of the erector spinalis muscle. So this is the medial border and this is the lateral border of the muscle. So this is the angle known as the renal angle. This renal angle in clinical anatomy, when you press it, it is maximum tender in the case of perinephric abscess. So we can elicit the pain through the renal angle. The kidney is about 11 centimeter long, 6 centimeter bore, and 3 centimeter in thickness. And it is reddish brown in color. Lateral border is convex and the medial border is concave, which presents the hilum. This hilum has the structure that are coming inside and going outside. So by looking at the structure present in the hilum, we'll know the kidney and of right side or left side. So in hilum, there is presence of the renal vein. Then there is the presence of the renal artery. You can see the lumen is small and thick, whereas the lumen of the vein is large and flat because the tunica media is thin here. And then at the third layer, we can see there is the presence of the renal pelvis. So this is the renal pelvis that is going downward. And then sometimes the afferent artery is also present, but this is the artery, renal artery, that is giving the posterior segment. And this is the anterior segment of the renal artery. The kidney is kept in its position by the coverings of the kidney that gives the hold to the kidney to get attached. The first layer is known as the fibrous capsule. So this is the fibrous capsule of the kidney and it covers the kidney whole around. It passes through the hilum and is present around the kidney structures. So these all are fibrous capsule. This is the true capsule formed by the condensation of the fibrous stroma of the kidney, and it is thin membrane. It can be easily stripped off from the kidney. You can see it can be easily striped off. The second layer is perinephric fat. It occupies the interval between the fibrous capsule and the renal fascia. The fat is abundant along the borders of the kidney and fill off the spaces of the renal sinuses. So these all are fat of the perinephric fat. So in chronic malnutrition, that is in the protein energy malnutrition, this fat are get utilized and there may be chances of prolapse of kidney. The third layer is the renal fossa. It is formed by the condensation of the extraperitoneal connective tissue arranged around the kidney, and it is continued laterally with the fossa transversalis. The renal fossa contains anterior and the posterior layer. The anterior layer is thin and is known as fossa of Told, whereas the posterior layer is thick and called as fossa of Zuckerkindl. Laterally, the both layer fuses and continue with the fossa transversalis. Whereas medially, the anterior layer covers the kidney, renal vessels, and with the opposite side of the renal fossa, in front of the. So this renal fossa, it comes and then it communicates with each other and gets blend with these vessels. That is the aorta and the inferior vena cava. Whereas in the posterior layer, this fossa, it covers the back of the kidney and the renal vessels and the blend with the psoas fossa, and it's attached to the body of the lumbar vertebra. Superiorly, the anterior and the posterior layer of the renal fossa, it ends in the kidney and then again re-split to enclose the suprarenal gland in the separate compartment. The anterior, after that, covering the suprarenal gland, it reunites and then continue with the subdiaphragmatic fossa to form the suspensory ligament of diaphragm. The suprarenal gland, that's why it is present in the different compartment, so we can remove the kidney easily without affecting the gland because it has the different compartment. Both the layer, that is the anterior layer and the posterior layer of renal fossa, inferiorly, they do not blend, they do not fuse. So it extends downward along the ureter and are merged in the extraperitoneal connective tissue. So the infection from the kidney, it can communicate inferiorly to the iliac fossa. The last layer is the paranephric fat. So this paranephric fat, it is more present in the posterior side, in the lower pole and the posterior surface and the posterior border. It fills up the paravertebral gutter and then it forms the cushion for this kidney. So from posterior side, the cushion effect is given by this, the last layer, paranephric fat. The internal feature of kidney, it shows the outer reddish brown cortex. This is the cortex. This is also the cortex. And then inner, the shiny, glistening pyramid, renal pyramids. In between the pyramids, the cortex structure is coming down, known as renal columns. So this is the renal columns. You can say this is the renal columns. These renal medulla are 8 to 18 in number. So they vary. Either they might be 8 or almost up to 18 in number. These renal pyramids, the apex of the renal pyramid, it forms the renal papilla. So this is the renal papilla. You can see this is the renal papilla, which opens into this minor calyx. So this space is the minor calyx. These minor calyxes are 7 to 13 in number and they are dilated in presence the cope-sepate depression which receives this papilla. So you can see this is the cope-sepate depression. This renal papilla, these minor calyxes, now they open into the major calyx. So now this is the major calyx. These major calyxes are 2 to 3 in number and formed by the union of these minor calyxes. Major calyx, they communicate and then they form the pelvis. This is the funnel sepate renal pelvis, which is formed by the union of the 2 or 3 major calyxes. These renal sinuses, they are the space that they contain the branches of renal artery, fat, renal veins, nerve plexuses, and the lymphatics. So these all are the space which are filled up by these structures and they are known as renal sinuses. talking about the blood supply of the kidney, this is the aorta that is present on the left side of our median plane, left side of our body in the median plane, and the inferior vena cava that is present on the right side of the median plane of the body. From this aorta, the renal artery arises from at the level of the L2 level, L2 vertebra. The renal artery enters the kidney through hilum. So you can see, as related in the hilum, the first there is the renal vein, then renal artery. Renal artery is behind the renal vein and the renal pelvis. So this renal artery, it enters the hilum. In this hilum, you can see the renal artery, where it is divided into 5 segmental artery. So this is the anterior segment, giving the branch to the anterior, that is the forebranch, and this is the posterior segmental artery. Now this segmental artery, it enters through as a lobar artery. This lobar artery traverses in between the renal column, forming the interlobar artery. That is between the two pyramid, there is the interlobar artery. Now it forms the arcuate artery, that is runs in the base of this pyramid and form the arc-shaped arcuate artery. Through arcuate artery, there is now, they give off the interlobular artery. So many interlobular arteries are given, and then they form now efferent arterioles. They goes inside the glomerulus, filters it, and comes out as a efferent arterioles. Now they form the peritubular plexus. This peritubular plexus is formed around the loop of Henle, and then it comes out as an interlobular vein. From there, now it follows the same pattern as artery. It forms the arcuate vein, that is as the base of the pyramid, and then now it comes between the two pyramid as an interlobar vein, and then the lobar vein, finally as a segmental vein, and then they forms the 5 segmental vein, comes out as a single renal vein. And the renal vein, it comes out and drain to the inferior vena cava. So you can see the right renal vein is shorter and the left renal vein is longer. As you can see, the inferior vena cava is at the right side of the median plane of the body.